Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. So in this video, we're going to talk about various medications. We're going to talk about epinephrine. We're going to talk about norepinephrine. We're going to talk about atropine. We're going to talk about dopamine as well as Dobutamine. So let's start with epinephrine. What is epinephrine? Epinephrine is considered to be a bronchodilator and a vasopressor. They belong to the adrenergic class. Okay, they are adrenergic medications. So what are the uses? It's actually used for anaphylaxis, and anaphylaxis is actually a severe reaction to something, right? And also used in cardiac support, advanced cardiac support during resuscitation. Mode of action for this, it stimulates the alpha-1 receptors, which result in vasoconstriction, and also stimulates the beta-1 receptors in the heart, increasing the heart rate, and beta-2 receptors in the lung, resulting in bronchodilation. Side effects for this include tremors, nervousness, dysrhythmias, as well as hypertension. And for this patient, we always monitor their vital signs. That includes the heart rate as well as EKG. Next medication will be our norepinephrine, and norepinephrine is also considered to be an adrenergic drug as well as a vasopressor. Uses are for shock as well as severe hypotension. Mode of action is it stimulates alpha-1 receptors, which are in the peripheral blood vessels, which result in vasoconstriction. It also has a minor beta-1 activity, meaning it reduces a minimum or a cardiac output to a certain extent, not that much. Side effects for this, of course, hypertension and dysrhythmias. And for this patient, we always monitor our vital signs, heart rhythm, our ECG changes. Atropine. Atropine is an anticholinergic medication. Cholinergic, they dry you up. So atropine is actually a funny way of remembering this. Atropine is a trampoline because they sound the same, and it's used to get the heart up. So we put the heart on a trampoline, it bounces up, it brings up the heart rate. So its uses are for like sinus bradycardia, heart block. It decreases secretion. Remember, it dries you up during surgery, and also it's used for post CPR sinus bradycardia. Our mode of action is inhibits acetylcholine sites in the smooth muscles as well as sensory glands and the CNS. It inhibits all these things according to the CNS. It decreases the vagal stimulation of the heart and allows for an increase in the heart rate. Side effects for this include anticholinergic side effects is drying you up. So constipation, bloody vision, dry mouth, urine retention, tachycardia. And for these patients, we actually teach them, right? They need to be monitoring the urine retention. We also help them do that. And we advise this patient to increase fiber and fluids because of the risk of hyperconstipation. And for their dry mouth, they can suck on a hard candy. So dopamine. What is dopamine? Dopamine is an adrenergic drug. It's an inotropic drug as well as a vasopressin. Remember, inotropic and chronotropic. So let's see what kind of inotropic it is. Is it a positive inotropic or is it a negative inotropic? So it's used for shock, heart failure, or renal failure. Its mode of action is it stimulates alpha-1 receptors, which cause vasoconstriction. It stimulates beta-1 receptors, which increases the cardiac output and cardiac heart rate, as well as it stimulates the dopaminergic effect, which it helps increase the renal perfusion. So it increases and everything, right? And we increase everything in the heart. So side effects for this will be angina and dysrhythmias because we're increasing everything. And we always place this patient on an EKG. We monitor their vital signs as well as their heart rate. Our next drug will be Dobutamine. And Dobutamine is an inotropic drug. It's used for cardiogenic shock and heart failure. Remember, cardiogenic shock is when there is something wrong with the heart circulatory system. Check our shock video. The mode of action is it stimulates the beta 1 receptors to help increase cardiac output, but it has a less effect on the heart rate as well as blood pressure. So it's mostly focused on the cardiac function, not the heart rate or blood pressure. Side effects of this include hypertension, dysrhythmias, as well as angina. We monitor this patient's vital signs, EKG, but due to the heart failure, some hemodynamics and pulmonary artery monitoring, like we'll have this patient have a wedge pressure or central venous pressure monitoring. The patient is important to be monitored as well. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.